Welcome. Today we're diving deep into bladder dysfunction, a common yet often misunderstood condition that can significantly impact quality of life. We'll explore what it is, why it happens, how it's diagnosed, and what can be done to manage and treat it. So, let's get started on understanding the ins and outs of bladder dysfunction. So what causes this dysfunction? Well, the etiology of bladder dysfunction is diverse and can stem from a multitude of factors. Neurological conditions such as stroke, multiple sclerosis, Parkinson's disease, and spinal cord injuries can disrupt the nerve signals between the brain and the bladder, leading to problems. Other causes include infections like urinary tract infections or UTAs, bladder stones, enlarged prostate in men which can obstruct the urethra, certain medications, and even diabetes. Sometimes, the cause remains unknown, which is termed idiopathic bladder dysfunction. Pelvic floor muscle weakness, often seen after childbirth or with aging, can also contribute to the problem. Let's talk about how bladder dysfunction actually works, that is, the pathophysiology. Normally, the bladder fills with urine, and stretch receptors send signals to the brain, creating the urge to urinate. In bladder dysfunction, this coordinated process goes awry. For example, in overactive bladder, the bladder muscles contract involuntarily, leading to frequent and urgent urination. Conversely, in underactive bladder, the bladder muscles fail to contract strongly enough, resulting in difficulty emptying the bladder completely. Neurological conditions disrupt the nerve pathways controlling bladder function, leading to either overactivity, underactivity, or a lack of coordination between the bladder muscles and the urinary sphincter. Obstructions, like an enlarged prostate, physically prevent the bladder from emptying effectively. Now let's consider the scope of the problem, the epidemiology. Bladder dysfunction is quite prevalent, affecting millions worldwide. Overactive bladder in particular affects a significant percentage of adults, and its prevalence increases with age. While specific numbers vary depending on the study and the definition used, studies suggest that overactive bladder affects between 11% and 16% of adults, and the numbers are higher in women than men. Urinary incontinence, another manifestation of bladder dysfunction, is also a widespread issue, especially among older adults and women who have had children. The exact prevalence is hard to pin down because many people are embarrassed and don't seek treatment, causing an underestimation of its actual impact. What are the telltale signs that someone might be experiencing bladder dysfunction? The symptoms can vary widely depending on the type of dysfunction. Common symptoms include frequent urination, needing to go more than 8 times a day or more than twice at night. Urgency, a sudden and compelling need to urinate. Urge incontinence, leaking urine with a strong urge to urinate. Stress incontinence, leaking urine with activities like coughing, sneezing, or exercising. Difficulty starting urination, a weak urine stream. Feeling like the bladder is not completely empty after urinating. And nocturia, waking up multiple times during the night to urinate. Pain or discomfort during urination may indicate an underlying infection or other bladder problem. How is bladder dysfunction diagnosed? The diagnostic process usually begins with a detailed medical history and physical exam. A urine sample is often tested to rule out infections. A bladder diary, where you record your fluid intake and urination habits, can provide valuable information. Post-void residual volume measurement, which checks the amount of urine left in the bladder after urination, can help identify problems with bladder emptying. Urodynamic testing, a series of tests that assess bladder function, is often performed to determine the underlying cause of the dysfunction. Cystoscopy, where a small camera is inserted into the bladder, may be used to visualize the bladder lining and rule out other problems. Bladder dysfunction manifests in different forms. We can categorize it into types based on the underlying problem. Overactive bladder, OAB, is characterized by frequent and urgent urination, sometimes with urge incontinence. Underactive bladder, on the other hand, involves difficulty emptying the bladder completely. Stress incontinence results from weakened pelvic floor muscles and occurs with physical exertion. Mixed incontinence is a combination of urge and stress incontinence. Neurogenic bladder is a type of bladder dysfunction caused by neurological conditions. Overflow incontinence occurs when the bladder becomes so full that it leaks urine without any urge. Each type requires a slightly different approach to treatment. Fortunately, there are several treatment and management options available for bladder dysfunction. Treatment strategies are tailored to the specific type and cause of the dysfunction. Behavioral therapies, such as bladder training, timed voiding, and pelvic floor exercises, Kegels, are often the first line of treatment. Medications, such as anticholinergics for overactive bladder and alpha blockers for urinary retention in men, may be prescribed. For more severe cases, other interventions may be considered. These include neuromodulation techniques like sacral nerve stimulation, which uses electrical impulses to regulate bladder function, botulinum toxin, a Botox injections into the bladder muscle to reduce overactivity, and surgery to correct anatomical problems or improve bladder support. Intermittent catheterization may be necessary for those who have difficulty emptying their bladder completely. While not all bladder dysfunction can be prevented, there are steps you can take to reduce your risk or manage existing problems. Maintaining a healthy weight, staying hydrated, and avoiding bladder irritants like caffeine and alcohol can help. Practicing pelvic floor exercises regularly can strengthen the muscles that support the bladder. Managing underlying conditions, such as diabetes, can also reduce your risk. Prompt treatment of urinary tract infections is crucial to prevent complications. And of course, don't delay consulting with a healthcare provider if you experience symptoms of bladder dysfunction. Early diagnosis and treatment can significantly improve your quality of life. The prognosis for bladder dysfunction varies depending on the underlying cause and the effectiveness of treatment. Many people experience significant improvement in their symptoms with appropriate management. Recent research is focused on developing new and more effective medications, less invasive neuromodulation techniques, and personalized treatment approaches based on individual patient characteristics. Gene therapy and regenerative medicine are also being explored as potential future treatments for certain types of bladder dysfunction. The ongoing research and advancements in treatment options offer hope for improved outcomes and a better quality of life for those living with bladder dysfunction.